We will keep on going to the next presentation, which is John Nyberg, Pure Biosynergy, Circular Water and Disinfection Solutions for Healthcare.
Yes. Hello, I'm glad to be invited, and thank you for great context. I'm gonna right away share screen. All right. Yes, so I'm John Nyberg, and I started this company, Pure Biosynergy Sweden, in 2015. To the left in the screen are our partners and companies now included in this presentation. Pure Biosynergy Sweden, with brand name PBS Generation, has one product, the unit. This is a game changer in disinfection and water purification. We minimize energy, water, and chemical consumption in existing solutions. With only air and a splash of water as our source, as well as locally produced electricity, we can disinfect and clean materials and water unlimitedly, with the addition that we have a product lifespan of at least 10 years, with minimal maintenance and adaptation to the toughest and most difficult environments. And everyone knows that water or moisture and high voltage do not usually go well together, but for us, it is a strength. And what we have solved this during 3 years of development together with Sigma, Lundinova, and Join Business and Technology. We found that the unit does not only withstand humid air, but the gas mixture that comes out of our unit fed with humid air has way higher oxidation and disinfection properties than the mere ozone has. So for PBS and capsule, this is a journey from traditional ozone technology to oxidation and disinfection with humid air plasma. We call it the H effect. Our first commercializable product, after about 5 prototype versions, are now in the making. So, for example, laboratory experiments that we've done at Swedish Environmental Institute show that bacterial spores that took us hours to kill with ozone were killed in 2 minutes with the gas mix from our unit. So compare hours with 2 minutes. One application branch for us is to expose items, materials, surfaces, containers, etc., directly to our gas mix to disinfect them. And the other application is to bubble the gas mix into water. And when we bubble our gas mix into water, it oxidizes the contamination, including killing viruses, bacteria, microorganisms, and so on. So what do we do with all this? PBS works business to business, and we offer our product mainly as a component or complement to water purification and disinfection solutions already existing, to reduce chemicals, to reduce water and energy consumption, and to some extent also replace chemicals totally and replace filters. We're now proud to be part of the Vinnova project Swash and Grow, led by Rice, presented earlier. And with our product, we address the off-grid wash sector. For example, Carex of Sweden. At the top here, we see a conventional sewage system. And below, we see Carex ecosystem-based sewage system, which enables circular use. In the particular context with Carex, we aim to, 1, pre-treat incoming water, i.e. break down pollution before it enters the Carex system. And 2, to post-treat the outgoing water from the system, mainly to enhance the quality further by eliminating microbial contamination and neutralizing color, smell, taste, etc. Most solutions providing drinking water today are not sustainable. I guess you are all familiar with this. Green water systems, Carex green water systems offer solar-powered optimized water solutions, water stations, where PBS products come in as one component. In a hospital, the water station concept can be implemented and duplicated in order to produce clean, safe drinking water with locally produced electricity and without any use of chemicals or plastic bottles. Unfortunately, this slide is in Swedish, but it illustrates the circular concept where the sewage water goes down into the ecosystem-based purification system and can be cleaned further by us in order to be reused or straight away for irrigation, for example. With offering these kinds of sustainable, inclusive concepts, PBS and the partners we cooperate with, we address actually 7 out of the UN Sustainable Development Goals. It's 3, 5, 6, 9, 12, 13, and 14. Another company we are having a strong mutual interest with is Way Out International. Way Out, they make automated IoT connected microfactories for local production of drinking water and associated logistic infrastructure for local distribution also of the water. The system with all its components is connected and designed for reuse of containers, kegs. Each and every system removes about 180,000 plastic bottles and 8 tons of carbon dioxide per month and delivers daily needs for healthy drinking water to up to 1,000 people or 300 households. The system can run on solar energy and cleans water from any water source, including salt water. These are examples of companies and contexts that we at PBS collaborate with to further enhance performance and minimize energy consumption, water consumption, and also chemical consumption. Thank you.
Thank you, John, for your presentation. Very interesting. And as you mentioned there, like circular solutions is a very interesting aspect to work with in this kind of settings. I think if you're building a new hospital in Sweden, for example, you already have water, wastewater treatment and waste handling and so on. But if you want to build the infrastructure from the hospital, you need to make sure you have the infrastructure around it. Exactly. So that's a very good point. Once again, thank you, John, for your presentation. You can ask questions in the chat and we will have more discussion later in the panel discussion. And the last but not least presentation today is by Anders Gripenberg, CTO at Xinix International, and he will talk about disinfection for health.
Yes, thank you so much. First, we will share the screen here. Xinix, disinfection for health, water, hands, tools, surfaces, and disinfection. We've been existing for more than 29 years, and we have made some plans what we want to do. There's about 11 million people who dies every year in kind of sepsis, blood poisoning related diseases. Actually 4 people dies in Sweden every day. So that is more than in traffic accidents. There's about 3 million people dies in waterborne diseases. We know that using our products, the cost for 1 liter of drinking water is 0.0005 euro. So it's quite cheap actually to use our products to get to bacteria-free drinking water. We have also decided that the money that we make in the European Union and the US, for instance, or in markets that can pay for our products, that would be used for those people in need that don't actually have the money and can afford to pay for the product. So for that, we have created the Xinix Foundation and bacteria-free drinking water. This should be a human right for everyone. So what we have actually, we have the best products for disinfection of water, AquaCare and Freebact, hands and surfaces and many more to come. You will see them in the market this autumn. An interesting project we have together with one of the world's largest corporations that will probably could be released in Christmas time. We have evidence-based disinfection. We have done more than 40 scientific studies. Johns Hopkins back in 2000. Today, everyone knows what Johns Hopkins is. We have 16 studies, standards, and we have a WHO certification, 3 stars for defending the E. coli bacteria. We got it now in February 2021. We also CE certification from Läkemedelsverket. And how we do this is by eliminating the RNA and DNA protein through our innovative product that we have developed by ourselves, stabilized chlorine dioxide. That's a chemical, yes, but it works without electricity, without any kind of support, and it can be stored a long time in open areas. So it's the best chemical to use for disinfection. We eliminate all kind of viruses, bacteria, fungi, protozoa, you name it. We also eliminate naked viruses and spore-forming bacteria. Alcohol-based products for hand sanitation, except, for example, doesn't eliminate spore-forming bacteria and naked viruses. So during the winter sickness in Sweden next year, you don't use alcohol-based products. This has no effect, soap and water or our products. Spore-forming bacteria is also one of the most severe bacteria forms we have, and it exists in the environment around us all the time. It can be resisting and waiting and resting for more than 10,000 of years. And one of the most severe cases is the sub-Sahara continent, where most of these 11 million people die from infections. Women giving birth to children get blood poisoning and dies from that. It's very, very severe. We have an excellent reputation of our products. Many NGOs that we cooperate with. We had delivered through United Nations to Myanmar, for instance. Among the companies, Rolls-Royce chose us to be their partner for delivery of the products for disinfection. It's quite a good reputation we get there. We also have support like the Eco Challenge Fiji. You'll go in and watch Amazon Prime. You will see amazing race where they really need our products for disinfecting drinking water and themselves when they're racing for 24/7. Our products have been used quite a lot in different disasters around the world. You can see them down here in Myanmar 2007 with United Nations. I think it was actually in cooperation with Läkarmissionen 2010 Haiti earthquake, but I could be wrong there. Maybe it was Star of Hope. I was by myself helping Médecins Sans Frontières in 2014 in Guinea, so fighting Ebola virus. And we have also ongoing talks with IOM, who is in charge of Rohingyas refugee here in Bangladesh, and more. To be able to do what we want to do and what we need, we need products that works, and we have that. We need to produce at a very low cost. Today we have 800 square meters in Bangladesh that we can produce in. Next year we will have 8,000 square meters, and in 2 years' time we have 60,000 square meters of production area. We need scientific-based studies, of course. Everyone is questioning and asking for proof of concept. With the WHO 3 stars certification, that is a feather in the hat for us. we need to make extra registration for our hand sanitizer in PT1. It will cost a couple of millions. Also, re-registration of our EPA that we got 2017. So we also need to make an FDA registration for the US market. That costs a lot of money, of course. Marketing for our products costs a lot of money. Expansion capital, we will raise hopefully 20 million now in this month. We need to expand our lab capacities in capabilities in Sweden, and also production capabilities and capacity here in Bangladesh and other countries. So what we have done, we made back in 2017 in Nyberg coast in Saikpo village, about 3,500 plus. They didn't know how many they were. And what we figured out is we must make a no-tech solution. They have a river floating by, got a lot of iron and manganese. So we're pumping up the water there to some barrels that we found. Price is like 20 euro for 1 barrel. Filtration with sand, gravel, something like that, and a piece of non-woven cloth between, separating these ones. And then we collect the water after that. And from that, we have almost iron and manganese-free water. We pump it to a tank, and we add our product. And so this is a no-tech solution. Everything bought locally, supported locally. The cost was 10,000 euro for the installation. The village pays us 2,000 euro a year for that. So it's their installation, is not ours. They buy the product from us for disinfecting the water. The cost for running this is about 5,000 euro a year. So that is 2 euro a person a year in running costs. So it's not very expensive to have a solution. The interesting part that we got reports from our partner in Ivory Coast is that women today don't give birth to as many children as they used to. Since they have discovered that children don't die, earlier they get like 7, 8, 9 children. A few of them died. Now less than 3 children, women that gives birth to new children now. That's very an impact on the birth rate. So that's very, very good news. They have cut down their health costs, of course. Less people get diarrhea. Almost none, actually. Some because they go swimming in the river and get some drink the river water still. They have never bought any water the last 3 years. So this is a very, very good impact actually on how we can have solution for a village and for a very, very low cost. This no-tech we have shared with UN organizations and anyone who wants to have more information about it, we give it for free. We have no interest in having anyhow. It's a no-tech solution. A little bit of our achievements. We know that we will be the world leading disinfection company by 2025. Our revenue would pass 500 million euro. We really want to make a difference for those in need. Through our Xinix Foundation, we can do that. And the reason for Xinix Foundation is that we give away 5% of our sales to the Xinix Foundation. With the Xinix Foundation, we can export our products to people that in need without paying the taxations for importing the products that we other need to do if it's a company to company. Save life, of course, save environment, create jobs, get down mortality with 50% where we are establishing ourselves, reduce reused material in all our products by 2023. We cannot get in Europe recycled PET bottles. Here in Bangladesh, we can get it. By 2023, we will have everything in our products, except for the chemistry, of course, will be reused. We estimate by 2023 we'll be about 12,000 employees, and by 2025, about 100,000 employees worldwide. But we are not doing it by ourselves. We cooperate with partners everywhere that we get in good contact with. We have already established Sweden and Bangladesh production units. We will have in the US soon, Ethiopia this year, Dubai also later this year, Thailand next year, Ivory Coast next year. We have already partners in Chennai district, so probably next year we set up production there also. And the good reason for this is that 99% of our product is water, and it's not sustainable to transport water around the world in containers. It's a stupid thing to do, actually. Our partners can be anyone that have the same kind of thinking as we have. Those who want to invest and make a lot of money, that is not our partner. If you make a lot of money and put that in the pockets of the employees and you reinvest in more and give the people in need products for cheaper price, then you can be a partner of us. But we cooperate with anyone, especially aid organizations, NGOs, and so on. Some key words: trust, understanding, acceptance, and also how to think of future sustainable development in all we do. And actually, we are setting up our new production here, 8,000 square meters next year. In this, we will implement a totally new way of thinking how to cool down a building. I'm from the construction business by myself. 10, 15 years ago, I built the second house in Sweden that made a micro agreement with Vattenfall as a producer of electricity. So, of course, we will have solar panels covering our electricity cost, but we will also have a totally new way of cooling down the buildings, since it's an enormous cost for countries in the heat areas to cool down the buildings. Much, much more expensive than heating up the buildings. This we can do with Nyberg and Lindab, for instance, who are experts in this, but we try to make it a totally new way. And all this knowledge that we make, all this data that we will collect, and we will share it for free. So anyone who wants to try and do what we have done will, of course, can do it for free. We will not charge anything. We will not take any patents or anything like that. They will be free for everyone to share it. But I think it could be a game changer in cooling down the buildings, actually. So that is a little bit short about us and how we are thinking, how we are working. I hope you get some information, and any questions, please feel free to ask, and looking forward to cooperate with you.
Yeah, thank you, Anders. Very interesting.
Thank you.
The thing you mentioned about local production is also something that is important when you want to establish healthcare and also establish local business opportunities to get the local ownership over the healthcare and the infrastructure, so to speak. Yeah, I would like to. That was thank you, Anders, first for your presentation, and now we'll go over to the panel discussion. Let's see, I can share my presentation again. Yeah, we'll have be a little bit more open with the questions now. So I would like first to ask the speakers about their inputs after hearing all these presentations, and then also for all the in the audience that can ask questions as well. You can raise your hand if you want to address something. So yeah, the question is an open question here. As we started the workshop, is how can sustainable healthcare be a leverage for implementing infrastructure in developing countries? We have heard a lot of inputs from different angles, and I'm thinking if we put all the pieces together here, what are your reflections? Do we have anyone who would like to start?
Could I suggest, Johannes, that we remove the slide, because then we will also be able to see each other more easily.
Good idea.
On the screen in order to interact more. I mean, if no one wants to start, I could start just briefly, or do you want to bring in someone else first?
No, please.
Okay. I have some quick reflections. I mean, first of all, this has been extremely stimulating hours because I love technology and new technologies, innovation, new solutions, and to be able to be concrete, not just to discuss the global development agenda in general, but to talk concretely. That is exactly what we need. quick reflections. How do we take the next step? First of all, from LM International, we want to discuss country-specific cases. Because we, as I've said earlier, for us, we always design solutions differently depending on which country we are in and the potential in each respective health system, the ecosystem services, the geography, the context, if it's humanitarian development, conflict setting, peaceful setting, the level of urbanization, growth, population growth, all of these factors. So I think the next step would be to agree if we are to collaborate, what specific countries are we talking? And in those specific countries that we're talking about, what specific regions are we discussing? Because many of the country contexts are huge. When we do our work in countries such as, for example, Sudan, these countries are huge. So we have to also be specific on regions. And even when we discuss county level, district level, or which level, because we have addressed almost all levels in the health system, specialized hospitals at national level, regional refer hospital, district hospitals, and we also work in addition also at the community level with dispensaries. But I guess in this workshop, since we're talking about new technologies, we might want to narrow it down to district hospitals or regional referral hospitals or national specialized hospitals. Next point I would say would be when it comes to areas where we drive, new technologies and transformation from a sustainability point of view. Are we narrowing it down thematically? Because some of us have talked more about the area of WASH in relation to sustainable healthcare. Some have talked more about new solar technologies in other areas and digital health and digitalization. So for us, it's important also to see how can we break the silos and have a holistic approach. That's what we want. That's what we learned in the Nordic Center for Sustainable Healthcare. So I think that what we should strive for, not to separate, but to see how we can work with sustainability from an integrated approach. But of course, we need to see what are the core dimensions. And my last comment would be, one thing we have learned in our organization is that we need capacity around new technologies. So for example, in Ethiopia, we have trained 700 medicine technicians together with the Ministry of Health and a university in Ethiopia. And they have been crucial in rolling out and developing sustainable healthcare infrastructure. So this is actually a need we see for other African countries. So from our perspective, it would also be interesting to look at the capacity building dimension. How can we add that and make sure that we also build the base for sustainable development, whereby new technologies can be effectively used, implemented, and sustained by locally trained staff. Thank you. Andreas, do you want to add anything before we let the others reflect?
No, go ahead. The rest in the panel.
Yeah, we could maybe talk about what Jan Furuvald talked about before, about the projects that we are looking for within Swash and Grow. And that is, I mean, it's based on the need and what you see there where there is opportunity. If we have a case you have identified on the field, then that can be a start to talk about and look at in what kind of need, what kind of financing is there for this geographical area and so on. So that I think you have to start with a need and find the project, and then we add the competence within this network to fill in with financing and technology and all the bits and pieces that comes with it. Jan, would you like to add something about that?
Absolutely, thank you, and thank you, Josephine, for to be specific and also country specific. Without mentioning names, I heard you had you mentioned you have a local office in Kampala, and I assume you cover even other Eastern African countries. Are Lekamisjonen, are they in a position to actually do the financing of a project? And in that case, do you work with restricted money or unrestricted money to work in this area? What kind of limitations or level of freedom do you have in choice of projects, and what you actually will be able to finance within the Lekamisjonen?
Yes, I can comment, and then you can give a complimentary, because Andreas is managing our department for this program, but I can give a first quick answer. So if we look at the setup of our organization, we are non-profit development and humanitarian actor, and our funding streams comes from broad sources. We have funding from UN agencies at country level. In many of the countries, we have, for example, funding coming in from UNICEF, but also other UN agencies and UN country pool funding. We have a framework agreement with ECHO for humanitarian EU assistance funding. We have one direct agreement that has just ended with SIDA. And then we have also other SIDA funding on the CSO side. Apart from that, we also worked with some other institutional donors, DFID, etc. And then we also have private funding, our individual base and mobilization of funding also from companies. When it comes to restrictions, I mean, of course, we have our country programs and the specific focus we have on the right to health, planetary health, people's health, and also restrictions around, I mean, our values and principles around human rights. So we couldn't collaborate with any company. Of course, it has to be diligence and standards, etc. But we are relatively free in the sense that we are striving to bridge the gaps and to be the platform for new innovative partnerships. So we are willing to lead consortiums, and we are willing to take the lead on institutional funding proposals. But of course, we always have to see that it's alignment with our standards and principles and values. Andreas, do you want to complement there?
Yeah, just to emphasize the need of working in consortiums, which we've done quite a lot. So that's probably the way we would do these kind of projects as well, to tap into that collaboration. So yeah, so a lot within the humanitarian context probably as well that we can bring in. So, but let us hear more about the specific projects, and we can take it from there.
Yeah, but in that case, I understand that you are actually more of open to a discussion for relevant projects with a certain needs in the new areas. You don't really need to go into the program is of course important, but you could actually within the program develop new projects, if I understand you correctly, Josephine.
Yes, absolutely. And that's why we have also established a new unit for innovation and digital transformation, because we believe that in development, too many actors are just replicating the same programs and projects year after year. And with only 10 years remaining for 2030 agenda, we have to work in new modes, ways, with new approaches, and we have to utilize new technologies. So we are really open to explore development of new programs together with you.
I saw Ian raising his hand before. It would be interesting to hear the other organizations that are working on the field, and Mamta as well. If Shantanu want to add something, we can start with Ian. Yeah.
Yes. Thank you so much, Johannes, and thanks, colleagues, for. Sorry, can you hear me? Yes, thank you so much, colleagues, for interventions throughout the day. Quite exciting to get all these nice experiences that colleagues were able to put across. I wanted just to raise one or two things that could have already been touched by Josephine. One of the issues is the need for us to promote research and evidence generation, because some of these products that we develop in, for example, Sweden, how do we make sure that they can work and operate in a country like Tanzania, like Zambia, like South Africa, which may not have the similar conditions as developed countries? So it's always very important for our projects to invest in research and innovation, which I think has been highlighted. And I think we've seen quite a lot of white elephants in the field because development interventions were not informed by research. I also wanted you just to also highlight another point, which is on capacity building, which again was raised because many of these things that we are doing, again, they need capacity for people to operate and manage over time. When I was visiting Tanzania last year, I was told now we have a room full of used solar batteries. What do we do? Where do we dump them? Because people never thought about the end life of some of those products just because we are addressing the immediate challenge. So we need to bring in the whole issue of capacity building so that people know how to manage and maintain. Some of those batteries that we have stored just needed a bit of touch here, they could still be reused. How do we ensure that the products that we are bringing, we are also building capacity? In many of these countries, we have got the huge talent of young people that we can hone on and begin to use them to manage some of these infrastructure that we are doing and putting across. The last point, again, is basically also to make sure that when we are addressing the needs of the people on the ground, we should also be talking to the manufacturers and suppliers so that there's that connection between the 2 points, to make sure that the procurement officers in developing countries are procuring commodities that they can use, commodities that are not going to cause harm, commodities that are not going to endanger people's lives. But at the same time, we need to take that message to the manufacturers so that they see that these are some of the things that they need to move. In the UN now, we have a joint initiative, which we call Sustainable Procurement for the Health Sector, where together we procure health commodities of almost $5 billion a year. So we use that as a platform to influence what is happening among manufacturers so that they give us products that are not going to harm the interests of the people. So again, as I said, there's always that need to ensure that the both supply and the demand side of the value chain of the health sector is strengthened in our implementation of health products. Thank you so much.
Thank you, Ian. Shantana, would you like to add something?
Yeah, I think thanks for wonderful presentations. I think everyone really detailed out most of the issues, and I think the wonderful work people are doing in Africa, I think something that India really need to learn from. And I think, and I also looked at some of the chat questions, and I really found that that since people have tried and tested and some piloted some innovations, some ideas on different things, but most of them have been done in either in the urban cities, particularly in Delhi or Mumbai, the metropolitan cities. So I think Daniel and Johannes, you had a visit last year in India, I think, and I mean you met a couple of professors and also the embassy in. And you meet the AIIMS Jodhpur, so doctors, and so I think it's also to look out and see. First of all, I think we lack data. I think that's a problem because we had a few projects. Some of them are like piloted on a few private hospitals. So it's important that we first find out what is the evidence from the government hospitals. There's something, because I know the load in the government hospital is still less than the private sector, but I think it's highly important that we, if you really want the government to push for it and to make it more sustainable, it's important that we collaborate with some of the universities that are funded by the government. For example, AIIMS Jodhpur, like we visited last year, and I think let's come up with a short plan. I think, and I have written an email ID. I think some of them were asking, so it's good to and everything, not from just energy, but energy, water, and waste. I think the three major components that we can take forward and see if that works well. I think Mamta, as an NGO, we would be happy to work with, I mean, any kind of model. I think that will, I mean, investment model, be it a corporate, a joint partnership model with like a strategic partnership with the technical university, and investment from a corporate, the local corporates in India, with support from the international agencies would work. Yeah.
Thank you. Vera, you have raised your hand.
Yeah, I thought I would jump in. Like, unfortunately, I have to drop off a little bit earlier, so I thought I'd just provide some comments as well. And thank you for the previous comments. I think it's been they've all been to the point of the discussion. But maybe just a few things that sort of came to mind as we were discussing here afterwards. I think one of the things that was said, and I think that was described quite well by Ian, is, you know, that really has to sort of be anchored in the local context. I mean, there's a lot of innovative approaches. There's a lot of innovative companies in a lot of these countries as well. So it's really, you know, there's really opportunities to create sort of more sustainable and long-term partnerships. And I think that is really important, you know, entering into some of these markets is having that, you know, having that sort of vision that, you know, it should be through local partnerships as well to both create that, you know, capacity building, but also to really sort of anchor the work in a more long-term sustainability approach. I think that is really important. And I think in other parts that was, I think it's good, you know, definitely to talk about different countries and different, and I think that could be one potential way of looking at it. But, you know, there's different, it's very different countries. So whether you're a low and middle income countries, you know, the countries are very different and the context is very different. So it's I think, you know, there are different innovations that are suitable for different contexts, and also depends obviously on the market environment and which companies are there already and whether it's saturated or not. But I think one other part that I think, well, at least we see the potential of is trying to look at more catalytic. I mean, that's what we are trying to look at, more catalytic investments where we can, you know, grow that long-term partnerships and local anchoring. So I think that's one of sort of seen as long-term visions. And I think the other part is, you know, in this more integrated, and I mentioned that before, sort of a more integrated approach to health system or health system or sustainable health system is really trying not to be part of the problem, but part of the solution. And I think one part of that is, you know, a lot of healthcare systems are very fragmented, and I think, you know, it's important to work towards the integration of them. And I think, you know, when we talk about environment and climate change, and we talk about different solutions and so forth, really try to have that more holistic approach, whatever your product is or whatever, you know, or whatever organization you work for, because we're seeing that as a big problem, you know, that there's a massive fragmentation in health systems. And I think it's important for everyone to sort of, you know, especially see that, to be very aware of that, not to be part of the problem. And I think a third and last one that I think it's an interesting one is that in many of these countries that we're talking about, or if we're looking at low and middle income countries, you know, there is a really, really thriving sector. In places like India, you have the majority of the healthcare is being provided through private organizations and private companies. And I would say for most low and middle income countries, that is true, with a few exceptions where you have a bigger public healthcare, but those are really the exceptions. So we're talking about a massive private sector that are working in these countries already. So, you know, there's also that aspect that I really think it's important to remember, that we are talking mostly about private healthcare in these countries. And therefore, you know, the partnership with private healthcare companies is obviously on the forefront of this discussion. And many of them are working in very sort of low income contexts, where I think there's a huge potential for these type of solutions. And I think Anders was mentioning some interesting work that they have done, but I think, you know, that is also one thing that I wanted to raise, is that the private sector is enormous, and they have to be, as a healthcare industry, has to be brought into the conversation at some point. So I'll just stop there.
Yeah, thank you, Vera. I wonder do we have any comments from the company side? Mikael?
I don't know if it's just because it's my first conference in this forum, but I'm I have to say I'm astounded by the know-how and the insight into what is happening in the healthcare industry. And while Shantanu was talking, I was doing a little bit of research on just for India alone, for example. If we're looking at if India is to achieve the UN recommendations for 3.5 beds per 1,000 inhabitants by 2030, we're looking at something like 1 million hospital beds that need to be built in India alone. And I'm just thinking, wow, in even just this little forum of insight, what a difference we could make from everything from, you know, waste handling to all aspects of sustainability. And I don't know, for me, it's just maybe an eye opener that we're not alone in our quest to try and do something better, you know.
Yeah, that's a very unbelievable.
Yeah, I can. For us at Nordic Center, this is fantastic. We see so many organizations joining up here from the Swedish side. We've been preaching this for many years, and trying to get people to understand how much interest there is around the world on Nordic sustainable healthcare and solutions we have. We're a small organization here, so our problem here is like capacity. We can't, you know, we get collaboration suggestion, that meaning that I would put 100 people on a location somewhere in the world to achieve what collaboration partner wants to do. So from our side, we really need to team up with stronger organizations to work towards it. But we can't basically manage ourselves all the requests we're getting. I've been getting the last few years. So the global interest, the Nordics are in some way, in many ways, the Nordics and Netherlands are world leaders when it comes to sustainability healthcare. We have reached very far, and the interest for sustainable healthcare is growing, as I said, exponentially. And they're turning to the Nordics, and then they Google Nordic sustainable healthcare, and they come to the Nordic Center for Sustainable Healthcare. So in some cases, we are getting today treated as an authority or a government function, which we are not. We're a small NGO. So this collaboration from the Nordic side to meet those demands are really necessary. So I'm very glad that we have several also Swedish Nordic organization with her today, because we are going to need all the help we can get to meet the demands. That's
thank you, Daniel. Yeah, we are approaching the end of this workshop. We have to wrap up a little bit. So I would like to thank all the speakers delivering very interesting talks on from their perspective of how to work on sustainable healthcare. Yeah, we have a platform already within the Swatch and Grow project, where we can start, discuss this, how we can work further on in this subject, and look into financing, how we can maybe make a project or a platform to work from together. So we will look in a little bit more to that the coming month. And if anyone who is interested to participate or maybe have a project that you can send to Jan, so we can take that up as an example and form a business plan around that, to see what kind of financing we would need, and companies who can deliver the technologies for that.
Johannes, if I just 10 seconds.
Yeah.
This was the background for the questions to Josefina and Andreas, because I believe we should try to create the case, the needs, and then actually offer the innovative companies to be part of this project. So
yeah,
it's to have this local anchoring with the Läkarmission should be an absolute fantastic starting point. So that was sorry for interrupting you.
No, that was a very good good point. So it should be demand driven, so to speak, and we should work where we stand, and organizations that are out on the field know the terrain and where the best impact can be. So, and then we can fill up with the companies and financing around that. We'll stay in touch, and I hope there will be a second workshop on this topic, and we can maybe dig in more if we have some examples where we can look into, and invite for new discussion, more focused on different topics. So with that, I would like to thank everyone again, and see you next time. If you want to discuss a little bit more here, we can do that as well. So thank you.
Thank you, Johan.
Thank you very much.
Thank you.
Thank you.
Thank you so much.
Thank you.
Thank you.
Interesting, everybody.